Thank you very much for your kind introduction. And I'm from CVVT. And I'm doing something that is affecting all of you here. So this is what we have been doing for years. We are doing surveillance of the wild birds and also the bats. And we believe that most of the emerging novel viruses come from these flying animals. They go into intermediate hosts and then jump into patients at what we call the human-animal interface, especially the market, hospital, and of course, when they go back home, they start to spread in the community. Now, so everybody knows animal surveillance and human surveillance are very important in preparing for the next pandemic. And indeed, we have been doing this for quite a number of years and discovered more than 60, now actually 80 different viruses, mainly in animals, but also in humans. And of course, you know about our discovery about bats, coronavirus HU4 and 5, actually 6 years before the emergence of Middle East respiratory syndrome coronavirus in Middle East. And of course, the bat coronavirus are related to SARS, and they are actually the ancestral precursor of our 2003 SARS coronavirus and also the 2019 coronavirus 2. And of course, we also have a porcine coronavirus HU15, which jumped into Haitian children just 2 years ago, which is published in Nature. Now, the problem with our animal surveillance program is that many of these viruses, although we discover the genome, we sequence the genome completely, but we are not able to grow it in cell culture, which means that we are not able to characterize it and prepare further in terms of diagnostic and also antiviral and also vaccines. Now, so that is what we did. This is the organoid. These are miniaturized organs, epithelial spheroids, in which we can do it with the bat intestinal adult stem cell. We can do it with the adult stem cell inside our airway. We cut lung tissue from patients with lung cancer. We use the normal part, harvest the adult stem cell, and grow this in culture. And you can see that they have the cilia beating rigorously, moving the central plug of mucus and cell debris in one direction. And it can be done, both in human and also in animal. And as a result, we are able to grow bat viruses using these organoids. Because, of course, when you use cancer cells, embryonal cells to grow viruses, it's not that easy, especially for bats. Now, so we can also turn these three-dimensional organoids into 2D. And again, you can see the vigorously beating cilia. Now, after you can grow this virus, you now have to characterize them and predict which one would jump into human. Now, of course, if the bat virus only grows in the bat organoids, but doesn't grow in the human organoids, we know that the potential for jumping is less. But if they can also infect the human organoids, then there is a potential it will jump into human. And therefore, we can then design rapid detection tests, which can both detect the common human respiratory pathogens and also potential animal pathogens that have a likelihood to jump into human. And then, of course, universal antivirals and universal vaccine platform would come into play. And I just want to impress you again that our locality is the hotspot for many different emerging infectious diseases in the past, and I believe that it would come again in the future. And that is a collaboration with Baptist University, Professor Lau, and we have this machine already approved in mainland China for screening purpose. And we can detect 39 human respiratory pathogens within a very short period of time. And then we have this live-attenuated mucosal vaccine in which we delete one of the gene, which is the virulence gene called NS1 inside the influenza virus, replace it with the spike RBD of the SARS-CoV-2, and it can be sprayed in the human. And as a result, we can achieve very good protection. It has undergone phase 1-3 clinical trial, proved to be safe and effective. Within 1 month after approval in December last year, we have administered more than 1 million doses in 6 cities in mainland China. We have done something which is useful, and please support us. Thank you very much for your kind attention.
Thank you. Thank you, Professor Yun. Thank you very much.